Now, before I invite today's keynote speaker, I would like to take the time to show a 7-minute clip about Taiwan's success story for your viewing. So please enjoy.
We look now at a COVID-19 success story. Taiwan is just off the coast of mainland China. Millions travel between Taiwan and the Chinese mainland. Johns Hopkins University had predicted that Taiwan would have the second most COVID-19 cases in the world. But today, there are 80 countries and territories with more than Taiwan's 329 cases. Nick Schifrin follows a Taiwanese woman going home to figure out how they did it.
I'm currently at the Gatwick Airport in London.
When 28-year-old Anna Lee left her boyfriend to fly home to Taiwan last week, she took no chances.
Why are you wearing a mask and gloves and goggles?
I'm trying to avoid any contact to air.
Lee didn't feel safe in Britain, where the airports are empty and the Prime Minister was criticized for a slow initial response.
If he is not even helping his own citizen, why would he help a foreigner like me? I thought, all right, I'll go back to Taiwan for now. Everyone's very careful.
So careful, Lee found fellow Taiwanese Jason Yang waiting for his flight to Taipei in a bodysuit bought off eBay.
I believe that in England, it's already lost control. And if I go back to Taiwan, I will be taken care of.
Taiwan is only 80 miles off the coast of mainland China. When Johns Hopkins modeled COVID-19, it predicted Taiwan would have the second highest number of cases. But that prediction did not become reality. Taiwan has succeeded at containing COVID-19 starting at arrival.
We are getting off the plane.
Lee Skyped with us during her hour-long journey through the Taipei airport. The first step Taiwan took was identifying possible cases.
They gave me this form to fill out my temperature in the next 14 days.
Lee told authorities she'd had a cough in the last 2 weeks, so security escorted her to secondary screening. She had her temperature taken, like this woman, and she filled out forms consenting to new regulations and providing recent medical history.
My temperature they just took, and it was asking like what syndrome I had, and if I went to doctor.
And she got a COVID-19 test at the airport. Taiwan uploads these results into its national healthcare database to create a kind of coronavirus database that everyone has to enroll in.
We have to register first online. They will send me a text message. I have to show them the text message, or we can pass here.
That's where government tracking begins. After her bags are disinfected, her ride home is in a government-provided taxi by herself. The 3-hour drive costs $80.
Now I cannot take any public transportation, so I had to use this contract taxi.
Lee headed home, knowing the government would stay in touch during a mandatory 2-week quarantine.
Welcome to my humble house.
The government has also stayed in touch with Mickey Du, who arrived from Australia on March 22nd.
Well, the first day, they immediately phoned me almost within an hour that I got home. Okay, and there were actually several text messages. When I first arrived home, there were like 3 or 4 text messages. Welcome back to Taiwan. This is the CDC. We're just checking to see if you're okay.
Mickey's girlfriend recorded him in his apartment. Everyone who arrives in Taiwan today is tracked by cell phone to make sure they stay at home. Taiwan's Center for Disease Control tries to make 14-day quarantines easy.
She asked me whether or not I lived at this address. I said, yeah, sure, that is my address. And I said, when are you going to be here? She said, I'm going to be there in 5 minutes. I'm like, oh, okay. And no, they showed up in 4 minutes. They were like outside. Like, so she just gave me a packet of masks, and there were 14 masks in the packet exactly.
Taiwan was able to take all of these steps because it learned lessons the hard way.
The SARS outbreak is a wake-up call for Taiwan, and we learned a lot from the SARS outbreak.
Dr. Steve Guo is the former head of Taiwan's CDC and led the SARS task force in 2003 when the SARS epidemic made hundreds of Taiwanese sick and killed more than 70, the third highest tally in the world. The very next year, authorities prepared for the next crisis. That preparation allowed Taiwan's CDC to detect the COVID-19 threat before the Chinese government announced it.
We pick up the signal that there's some strange outbreak in the Wuhan areas at the end of the last years from a social media networks. we decided and we did send 2 medical doctors to Wuhan from Taiwan CDC to get a better understanding of what happened there, okay? And then 5 days later, on January 20th, the government decided immediately to set up and activate the central command centers.
That centralized command center launched border restrictions before almost anyone else, set local quarantine rules, and turned to technology. One phone app allows Taiwan residents to find stores with masks in stock. Another app provides information on all of those who are COVID-19 positive, where they've been, and their case histories. And the government made sure it had enough medical equipment.
After the SARS outbreak, actually, we have the law to require hospitals to have a stockpile for all medical supplies for 30 days for the hospitals.
Another reason Taiwan acted so early, they didn't trust either the Chinese government or the head of the World Health Organization, who in January praised China's response, says Bill Stanton, the former top U.S. diplomat in Taipei.
He was just defending the Chinese position and echoing what they had to say. And it made the Taiwanese even more suspicious to what the Chinese were doing for that reason. China doesn't allow Taiwan into the WHO. And that's really stupid, because Taiwan is one of the main countries in the world that has expertise on international health issues.
For Anna Lee, that expertise translates into trust in her government.
I feel like even if there is something wrong with my body, I will be taken care of, which is quite promising. I'm quite happy with how government take it very seriously. That's why we keep the cases very low.
Which means for Anna Lee and many Taiwanese who are quarantined today, there's no place like home. For the PBS NewsHour, I'm Nick Schifrin.
Today, Taiwan announced that it would donate 10 million masks to medical workers around the world, 2 million to the U.S.
Able to appreciate in the video on just how Taiwan's preparedness and quick responsiveness acted during this pandemic. Now, before I invite our keynote speaker, I would just like to remind all participants to please mute your microphones. If you have any questions, feel free to submit them in the chat box. You can submit these questions or in English or in Spanish as well. So now I have the pleasure of introducing today's keynote speaker, Dr. Steve Su-Sung Kuo. He's currently the Ambassador-at-large of Taiwan. He was the former president at National Yang-Ming University and former Director General of the Taiwan CDC. His specialties include infectious disease control and prevention, as well as public health policy. Welcome, Dr. Guo.
Okay, thank you. Hi, everyone. Again, good evening and good mornings. It's really a pleasure for me to talk with you some of my experience and actually the experience of Taiwan. So the video you just saw is only one of many international reports about the Taiwan experience. And that one is pretty early on. And obvious, the reason I pick it is because that I was there, okay? And it did a very report and to point out that we learned a lot from the SARS outbreak. So what I'm going to do in the next about 30 or 40 minutes is just to share some of the experience we have during the SARS and on to the COVID. So the title I pick is From SARS to COVID-19, Taiwan Experience on Global Health Security and the Governance. Next, please. So why Taiwan success stories? In my view, I think is the right combination of some of the key elements. Speed, that means a very rapid response to early signals of the outbreak in Wuhan, solidarity that the people in the governments, regardless of which party, can work together, And technology, which means that, like you see on the videos, that we do employ some of the advanced digital technology. And also we have a very good national health insurance system, including a smart health card. And trust, leadership, and also some luck. By that, I have to say that, we are very lucky that last year in the early days of the outbreak, so we have a vice president who happened to be a war-announced epidemiologist, okay, and before he retired from the vice presidency. And so that is basically the some of the elements I think is very important for any disease control activities. Now, currently, as some of you knows that Taiwan has only a big outbreaks during the May of this year, and this graph is from the Taiwan CDC epidemic centers. By the epidemiology week from week 1, 2020 to week 2045, which is last week of this year. And so you can see we have a small, tiny outbreak in the early days of year 2020. We control that, and then it just have a little bit outbreak in the May of this year, but fortunately that we also control it to a very low level. Next, and also in terms of the mortality, actually we are doing very well in terms of the population mortalities. We are quite low compared to OECD countries, and even lower than what happened in the United States, as you all know. And the performance of the COVID-19 control this time is even better than in 2009 H1N1 outbreak. Well, actually in Taiwan, over the last 20 years, we have 10 major epidemics in addition to SARS. Before the SARS, actually in 1999, we have EV71 outbreak, which killed 78 kids, children in our countries, and almost brought down the health ministers at that time. And so actually, that is the starting point of a rapidly reform overhaul of the disease control system in Taiwan. And certainly the SARS is the biggest event for Taiwan. Taiwan became the third hardest hit areas around the world. And so, but after that, we have H1N1 in 2009. We have H7N9 outbreak in 13, Ebola. Although we don't have Ebola, but it's really scared a lot of people around these regions in 14 and 15. Zika, influenza outbreak, H1N1, and MERS. Okay, I'm sorry. The H1N1 is really 2009, but we have a seasonal outbreak, a huge one, in 2016. MERS. 2018, and then the Covet this year, last year. So over the years, I think we didn't miss the opportunity to sort of seize the opportunities to learn the lessons we have over the last 20 years. And I conclude, wait a minute, let's back up a little bit. So one more, back up. So I actually, conclude all the lesson into a simple message. I call it epidemic control. 1, 2, 3, 4, 5. What's that? I mean 1, 2, 3, 4, 5. Next, which are one key core understanding that all epidemic is like an iceberg. Okay, so the the tip of the iceberg you saw is only the thing you can detect. And there's a lot you probably don't know. And bear in mind the idea of the iceberg image. The next. There's a two key message. Pandemic control is like fighting a war. 防疫视同战争 in Chinese. And so fighting a war is always messy, okay? Setbacks are common and speed is everything. 速度决定一切, okay? And never, never, never celebrate a victory prematurely. We learned that message in the SARS outbreak, okay? In the early of the SARS, we thought we did a very good job, and so the governments did a good, very big propaganda calling Taiwan is a 3-0 country, zero mortality, zero outbound cases, zero domestic cases, and what you know that all of a sudden so we have a big outbreak in Taiwan. So never, never celebrate too early. There are three types of immunity. And so from the country's perspective, the defense you build is really a combination of these three types of immunity. First, immunity incurred by the natural infections, the immunity as a result of vaccines programs, but also very important, there's the immunity that you can build by behavior change, okay? You call it NPI or, like a wearing mask, a social distance that people now, everyone understands. I call it, this is the individual universal precautions, IUP. And so before you develop the vaccine, you can always to find out the transmission route and develop a very good way of a behavior change to cut and block the transmissions. So the three types of immunity. And then there's 4 lines of defense, okay? You want to stop the spread of disease abroad before you import it, introduce the outbreaks to your countries. So that's why, we develop a system. We always send our medical docs to everywhere in the world when there's an outbreak at the risk to Taiwan, okay? That's why I said, when the Wuhan had outbreak, we immediately sent 2 medical doctors to Wuhan, way before the WHO announced there's a international outbreak. And certainly the second line of defense is the border controls. And we did that very successfully for this COVID-19. And you have to do that, earlier. So you don't miss the opportunity to control that. And so certainly the third lines of control is the community. You do vaccination, do public education to build a very good consensus on behavior change. And certainly the last, but definitely not the least, is to preserve the hospitals. And we also learned that during the SARS outbreak, when we have a big outbreak in one hospital, Heping Hospital, because when you have a hospital got nosocomial infections, then you will scare the public because they will believe that even the doc cannot protect themselves. Okay, so you create a panic. Not to mention that if you cannot preserve the hospital, you cannot treat the patients. Okay, so there's a 4 line of defense in conceptual, and then there's 5 measures of disease control. Next slide, please. So actually, I have always talked to my students that, it's not complicated to disease control if you understand. Basically, there's only 5 I's you have to remember. That is the 5 major interventions you have to do in any disease or pandemic controls. First, investigation and surveillance. That's the first I. And the second, isolation and quarantine. That's the second. Immunizations. Vaccine immunization is always the optimal weapons for any infectious disease, but you take time to develop that. And then the fourth is information and communication. I think every one of you will agree. It's very important to do the communication, the risk communication to the public. And that's why, in Taiwan, whenever we have outbreaks, we will set up the control center and have the daily press conference to the public, to provide the transparency, the information necessary to everyone in the communities. And then the fifth I is the international collaborations. I think that is very important as well, and probably that's the reason we have this these activities, to work with every one of you to have a better disease control down the road. Next. And so let's talk about SARS. I think the key problem or the lessons we identify in the SARS outbreak, including lack of a risk consciousness of the countries. At that time, I think no political leader in this country would believe that infectious disease is part of the national security. Now, after the SARS outbreak, any political leaders, with or without medical backgrounds, will understand, infectious disease is truly something and will bring down the governments altogether. And so, but at that time, we don't have that consensus. And secondly, we don't have a flexible enough system to cope with SARS outbreak. And then there's no command system coordinate, and so we can deal with that. And we and also, the case definitions is not adaptive to the epidemic evolutions. And so that is only some of the key lessons we learned. And certainly the SARS, unlike in many of your countries, you don't have SARS, but at that time in China, in Singapore, in Taiwan, Hong Kong, Canadians, all learned the same lessons from SARS. Next. And then the cooperation, international cooperations. During the SARS outbreak, at that time, I was the coordinator of Taiwan SARS task force. So I have to work with the experts from the WHO. I have to work with the people from the US CDC. And the ladies in the red circle is Dr. Kathy Rose. And I have to say that we learned a lot from her. She is still working in WHO, so, a very senior person right now. Next. And, in is 2000, and I think is June 17, when WHO removed Taiwan from the affected area, from the travel advisory. They post a news in a WHO website quoting Dr. Kathy Rose about the situation of Taiwan. And she said that the SARS stimulated vast and very rapid improvements in the health infrastructure, especially in the areas of hospital infection control procedures, system for data collection and reporting, mobilization of the public, blah, blah, blah. But he also said this, He said, we hope these improvements are permanent, as if she knows that we Taiwanese or Chinese is always a short memory, okay? So I always quote her sentence, when I direct the Taiwan CDC, to remember we need to institutionalize all the change, okay? Next. And also I have to say something about the US CDC. This pictures was taken in the May of 2003 from the health minister then in the Meadows, Dr. C.J. Chen, signed letters to WHO to request removing Taiwan from the travel advisory. With the help with the lady, Susan Maloney. Okay, she led a team altogether, something like 20 from the U.S. to help us to convince the world that we did control the SARS outbreak. And believe it or not, CJ later become the vice president of the Taiwan. And then she is really kind of a figure person during the early days of COVID-19. Next. And so we learn a lot from these international cooperations. Later on, we adopt the spirit of international collaboration in many instances, like this one, when there's a Ebola outbreaks. Actually, so we sent our medical doctors to Nigeria to work with our friends in Nigeria about how to deal with the Ebola, although we don't have any Ebola cases in Taiwan. Next. And that is part of a efforts we try to do to work with the global health security agenda of 2012. Probably some of you know very well about this agenda, which was initiated by President Obama in 2012, while I was a health advisor in Washington, D.C. And quickly, we joined the agenda. And that agenda is really an effort to respond to the failure of WHO works, try to elevate the preparedness for every countries in the world, result from the 2005 IHR. So the idea is to elevate political attention and encourage multi-stakeholders participation and coordinations, okay? And like in Taiwan, you have to make the political leaders understand that outbreak, pandemic is not the responsibility of health minister only. It needs to take a whole sector's efforts. And that is the initiative of GHSA. And so one of the things is very important at that time, as we all understand that most of the disease is a zoonotic disease. So you have to work with not only WHO, you need to work with OIE as well. And they are two separate entities under UN. And so later on, we have that One Health initiative, okay? And now the global health security agenda move on the broken supply chain, including semiconductors and also pharmaceuticals. So now you have to bring economic and commerce department all together into the country to solve the health security. And so that is the recent development. But anyway, under the health, global health security agenda, so we did a lot of things, including, we do a training workshop for the neighboring country, the South Asia countries. Next. And also we, under the GSAS, we work with the US to send hundreds thousands PPEs to the West Africas. We invite 70 countries from the South Asia, the Japan, the US to have a workshop on laboratory diagnosis for Zika, for instance. And this is already always is bipartisan. It's not a political initiative, the efforts. Next. And that's said about a little bit about the central command and control system. This is the Central Epidemic Control Centers established, right before the Wuhan outbreak in January 20th. And they have the daily press conference every day. I mean, so this pictures is very familiar to the people in Taiwan. And this is not new. Actually, this is the practice after we have the SARS outbreaks. For instance, this one is from the outbreak of H1N1 when I was still the Director General of the Taiwan CDC, and in the center is actually the premier at that time, Dr. Liu, and the health minister. So we have the systems, built over time. Next. And let's talk about vaccines. I think now, I guess the most important thing is that to try to get every people's vaccinated around the world. We are lucky that right now the coverage rate in Taiwan is 73%. Although the full vaccination percentage is still low, we have that policy, to get everyone for the first doses before we get everyone for the seconds, and that is the result of our, conscious policy. And I know a lot of your country is also catching up, and certainly I think the government is trying very hard to find a way to work with other countries, work with WHO, work with the Covet to make everybody have vaccines delivered. We are lucky also that Taiwan now have 3 domestic vaccine manufacturers. Actually, in the early days, all 3 domestic vaccine manufacturers were trying to develop COVID vaccines, and one of them actually did succeed. And this is a report from CNN about this successful story, Medicine company. And recently, Medicine's COVID vaccine was selected for WHO Solidarity Trial vaccine, which is now ongoing in 3 countries, in Philippines, in Mali, and in Colombia as well. And next. And actually, so far, the Medicine, the domestic vaccine, has produced some 5 million doses to get something like 800,000 people vaccinated, including the presidents, the Tsai, the vice president, Lai, and also my mom, who is now actually 19 years old. Actually, she got the shot 5 months before the president, Tsai, and vice president, because she was one of the phase 2 trial subject. As a matter of fact, she becomes the oldest people, the human subject, in the history of the Taiwan clinical trial. That was the pictures I with my mom when she celebrated his her 19 years old birthday. Okay, and this is the daily vaccination uptake of Taiwan vaccination programs. You can see, actually, we adopt and use a lot of international vaccine, including AZ, Moderna, and BNT. And Medicine was lucky to get a spot in the early days of the vaccine programs. Actually, I think Medicine can do more, but as you probably know that, as a as a democratic countries, sometimes it's not always perfect. Things like vaccine can be politicized. And so that is the new lesson that we learned this time. Next. Next one. Okay. So so basically, I would say that the pandemic, the COVID control in Taiwan is very successful, but really nothing is kind of a perfect, and so the vaccine, the domestic vaccine, is one of the things that we need to improve, to make it not to be politicized in a way, and so we can take advantage of our domestic vaccines even more. And this actually, the last slides I have, that is to say that this is a Professor Ji Junhui from Oregon State, and his article about Taiwan and the politics of vaccine warfare. We have a different political parties. Just unfortunately that they use the vaccines as a political tool to do the infightings. And also, as you probably know, that we have a not very friendly neighbors across the Taiwan Strait. And so they also try to attack Taiwan by using the vaccine as political weapons. But anyway, if you're interested in know more, then I can talk, but let's leave it there. Anyway, so in summary, let me just say that Taiwan has learned many various lessons from SARS outbreak in 2003 and started to overhaul its disease control system since then. And I believe speed, solidarity, technology, trust, leadership, and luck, also luck, I would say, are keys to Taiwan's success in control of COVID-19. And I believe a robust command and control system is vital for any crisis management, including pandemic control. And last, as WHO has repeatedly said, no one is safe until everyone is safe. Thus, a fighting pandemic requires genuine global collaboration and solidarity. That's it. Thank you very much.
Thank you so much, Dr. Stephen Guo, for sharing your insight and expertise, and as well as Taiwan's experience during the COVID-19 pandemic. So opening up the floor for questions, Ms. Lisette Paul from Belize asks, what is the treatment that Taiwan is using to treat COVID-19 to achieve such a low fatality rate?
So far, there's no very effective way. As many of you knows that you do have remdesivir, okay, from Gilead. You have a new drug, monoclonal antibodies from some Japanese firms that you can use for the mild cases. And also recently you have something from Merck and also Pfizer just last week. And every time when you have that, the government has decided to purchase. That is not cheap. But I have to say that treatment is only part of the answer of lower the mortality. I mean, the true answer is really, early response to the outbreak, so you can bring down the cases as much as you can do. And also in the clinical management, the drug is not the only thing. You need to respirators. And so actually, right after the H1N1, we did a survey and have a preparedness plan for all respirators in these countries. And so when you have an outbreak or a concentration of patients, you do have a plan to move around all the medical equipment quickly. And so treatment, medicine is important, but it's not the all answer. And certainly now you have vaccines right now. So currently vaccination is the most important things to do. Yeah.
Much for that answer, Dr. Guo. We also have another question from Dr. Gerardo Hernandez from Guatemala. His question is, what are the names of your domestic vaccines and what are their compositions?
Okay. It's called the Medigen, okay, like you see in the slides. And actually is a subunit protein vaccines. It's not a messenger RNA. Is not a viral vectors vaccines like AZ. It's more like a Novavax. Novavax, okay, is a protein-based vaccine. So it's less side effect, although it's a little bit difficult to produce. And actually, the technology is from the US NIH. So it's a product of the US and Taiwan. Yeah. This company is lucky that they have a relationship with US NIH for more than 5 years because they are developing the dengue vaccines. Okay. So based on that experience, they have the opportunity to work with the NIH. And I'm pretty much sure that actually the Medigen is probably the only one foreign company to work with NIH, in addition to the Moderna, which is work with the NIH, as many of you knows. That, yeah. And so right now, actually, there's another clinical trial in Paraguay, okay, right now. So so they are talking about, probably down the road that we can ship some vaccines to South American allies. But it also, you need to clear the regulator authority and that of things. And so this is ongoing strategy. And certainly we would expect and look forward to all opportunity to work with, some of your countries, if that is a need for our friends. Okay, so so basically that is the answer. So if you want to know more, it's easy to get to see the details of the composition, and also they adopt the same adjuvants as many of the major vaccine company. Adjuvants is from the U.S. Company, is Dynamax, okay, is endorsed by WHO. So it's pretty much, well funded and good vaccine, I would say. At least my mom has used it, and it turns out very well. Okay, yeah. So that's based on my personal experience. Okay. Yeah.
Thank
and
you.
Believe it or not, actually, because my mom is just the human subject. So I personally test her blood to see the antibody titers. So, I know very details about everything about these vaccines. But anyway, it's a good vaccine.
Thank you so much, Dr. Go, for that answer. And we have one last question from Dr. Jefferson Paul from Haiti. What are the strategies of Taiwan to get the people vaccinated?
Okay, thank you for the questions. I have to say that the early days, people is not that enthusiastic about get the vaccine, especially the vaccine AZ, AstraZeneca, because there's a report that AstraZeneca caused a black cloud, and also some of the European countries didn't really adopt. And the US so far hasn't approved AZ vaccines. But we know AZ is relatively safe compared to the risk of getting COVID. And so by doing a communication campaign, that and also bring some of the doctors and even the prime minister as as one of the early the recipients of the vaccines do help. And so people can say, well, my doctor used AZ, so and also the health ministers, very popular health ministers in Taiwan right now. He did use AZ vaccine in the very beginnings. But I have to say that the reason people are not rejecting vaccine is because we have that outbreak in May, and so it scared people, and then they really get to vaccinate. And we are lucky in Taiwan. We don't have the anti-vax movement like in the Europeans or the Americans. Okay, and maybe Taiwan people is more kind of trust to the governments. I don't know. It's probably part of the countries, but like I say, probably down the road, many years from now, then we have the same anti-vax movement, but so far we don't. Okay, so that's why I'm saying, sometimes you need some luck to get have a better outcomes. But so far, I think the vaccine hesitancy is not a problem in Taiwan. Communication campaign, leadership by the key person, people who trust, it helps. Yeah, but also sometimes you do need a small outbreak to encourage people to get the jab. That's also, yeah. Thank you. Yeah, our friend from Haiti. Well, I have been visiting Haiti more than 10 times, during 10-year the periods. Yeah, so I know Haiti very well, and definitely look forward to work with our Haitian friends, probably in vaccines or other things. Thank you.
Thank you, Dr. Go. I'm always impressed by Taiwan's sense of social responsibility. One last question for your expertise from Ms. Lisette Bell from Belize. Is Taiwan administering boosters for COVID-19 vaccine or mixing of vaccines?
We are now adopt a mixed scheme policy just from last week, I guess. So that's not a problem. The third dose is under considerations. Okay. So just last week, actually, the managers published papers on its efficacies on various mutants, and it's proved very well. It's on the journal called Clinical Infectious Disease last week, and also another papers on Lancet, and it do raise the question whether or not it's a good idea to have a third booster shots. Okay, and so far, because we have that one shot for everyone first policy. So we will come to that later on, okay? And actually, I'm thinking for my mom, because my mom, 90 years old, she has only 2 shots, so probably she need the 3rd booster shots, okay? So yes, we are considering that too as well right now. And we will have that answers pretty soon. Thank you. Thank you for the questions.
Thank you so much, Dr. Guo. So I will invite all participants, please, can you turn on your cameras so that we can have a group photo with Dr. Guo?